Serving all of San Diego, this is your Fox 5 News.
Imagine undergoing a serious operation and waking up while doctors are working on you. What every patient should know before going under the knife. Well, every year, some 200 patients in the U.S. report a frightening condition that's called anesthesia awareness. It happens when the patient is left fully conscious and can feel every cut during surgery. Now, my next guest created a foundation to eliminate this occurrence, along with other problems arising from anesthesia. Dr. Barry Friedberg joins me now with everything patients need to know before going under. Good morning, Dr. Friedman.
Good morning.
Before we start, talk to me a little bit more about anesthesia awareness and the likelihood or possibility of someone actually waking up during surgery.
Well, the multi-center study out of Emory University determined that about 1 out of 1,000 patients actually experiences anesthesia awareness. And if you look at a group of 40 million patients a year, we're actually looking at 40,000 patients, not 200 patients a year, as a potential thing. That is a very real problem, and it's a function of the fact that anesthesiologists are simply not measuring the right thing.
Well, how can that be?
Well, because this is what we grew up with. We didn't have this technology, the brainwave technology, until after 1996. Now, I cut my teeth a long time ago. In 1977, we had this, and we had the pulse oximeter.
You had this. What is this?
This is a vital signs monitor. This gives you the blood pressure, the patient's heart rate, and their oxygen saturation.
Right.
And so these are all wonderful indications of what's happening at her spinal cord level.
Which is what I was going to ask you. Wouldn't there be some sort of a vital sign indication for the doctors to know that this patient is actually the blood pressure is higher than it should be during surgery?
This is precisely the belief system that we taught ourselves before we had this technology.
And what you keep pointing to this technology. What is this, doctor?
This is called the brain monitor, and this is an essential ingredient for general anesthesia, as we'll talk about later. All these vital signs tell you is what's happening to the patient up to the level of her spinal cord. Unfortunately, the anesthetic drugs that we're giving are designed to medicate her brain. And even though changes in heart rate and blood pressure have been discredited as notoriously unreliable, it's very hard to change people's belief systems because beliefs are not a rational thing. Otherwise, the 3,000 or so scientific studies that validated that this actually works would have convinced the vast majority of anesthesiologists to use this technology. So,
let me see if I can understand what you're saying. The old-fashioned way,
the 20th century way, the 20th century way.
You can obviously read the blood pressure levels, vital signs, and you know what's going on in this patient's body head to toe.
No.
No.
Neck to toe.
So the new way gives you head to toe.
Head to toe.
So
yes,
wouldn't that be better?
Infinitely better, because before we had this, before we had this technology, every patient presents a mystery to the anesthesiologist.
Right.
And the best we could do on this basis and the 20th century belief was to guess. Okay, and we're very good guessers.
But so now then it should be, the problem should be rectified. This should not be happening as much.
Exactly, if the monitor was in wide use.
Well, why isn't it? It's too expensive?
Well, the $20 sensor, the hospitals haven't figured out a billing code for. Most people think their brain is worth more than $20. Also, as we said, the anesthesiologists are still stuck in this whole belief system that heart rate and blood pressure changes are a clue to what's going on. But to compensate for the fact we knew that wasn't the whole story, we would over-medicate by a factor of up to 30% more medicine than we thought you needed for fear of creating the anesthesia awareness situation.
So, Doc, you're a board-certified anesthesiologist, you told me. Do you still practice someplace?
Yes, I haven't gotten it perfect yet, so I keep practicing.
All right. But I'm pumped, Doc. All right.
Thank you. Thank you for humoring an old doctor.
But this is, I'm actually floored by this because it's quite scary to think that if I'm on a table here, a gurney, and I'm in the operating room and I could possibly wake up.
Precisely. Precisely. And it's your right as an empowered patient to tell your anesthesiologist before you get to the hospital that unless I have a brain monitor for my general anesthesia, I have to go someplace else. And trust me, faced with the option of losing the revenue for the hospital for that surgery versus eating a $20 cost, they will gladly accommodate your request.
But you keep saying $20. This machine has to cost more than $20.
Typically, the company gives the hospitals the machines.
Most then I don't get it. I'm confused. You can understand why I'm confused, and you're like, no, I'm perplexed too, and I'm in the business, and I don't understand why people are going to this. Okay, that's a whole other issue. Let's talk about then what the patient's feeling. So you're saying, let's say our intern here, Whitney, is our model. You're operating, doing open heart surgery or something, and she could possibly feel it.
Yes, that's a high-risk surgery.
And but because she is partially, she's supposed to be fully under, she is paralyzed, so she may not be able to raise a hand or give a sign. Or
and she has a breathing tube sitting between her vocal cords, so she can't even talk.
Wow. Okay. Okay. This is unbelievable. Okay, I got to run, they're telling me, but lastly, if you can answer this quickly, is it possible to be over anesthetized?
Yes, as you can see here from this thing, that under anesthesia and over anesthesia, two sides of the same coin.
Huh.
And the bigger problem is over anesthesia.
What happens if you're over anesthetized?
You run the risk of delirium, dementia, or even death.
My word.
Yes.
All right, Doc. Interesting information, and I hope you guys straighten it out within your field. Well,
it'll take the public to demand this change. That's why I'm here to. That's the goal of the foundation.
So ask for this machine if you have to.
Ask for a brain monitor if you're going to have general anesthesia.
A brain monitor. You guys got that? A brain monitor. Ask for it, or Dr. Friedman saying go someplace else. All right. Well, thank you. That's an eye-opener. For more information about protecting yourself before going under anesthesia, visit our website and click on the Scene On tab. Dr. Barry Friedman, thank you so much. And Whitney, thanks to you. All righty. And good luck in school.
Doctor, that makes total sense to me. I mean, just in theory, you know.